talking of natural and induced environment. So what you were talking of is an induced environment.
Yes, but it is a natural for him. He is learned behavior.
Right. Fine. So, I mean, basically the treatment has...
And we can compare it as obesity in modern terms and with prameha. That is, prameha is a wide term used for different types of urinary disorders, but particularly here I am going to talk about the diabetes mellitus, that is madhumeha. I don't know how many people know about the Banaras Hindu University. This is the front gate of our university, along with the statue of etiological factors which are described responsible for the Medo Rog in Ayurveda, like ahar, that is the diet. Diet plays a very important role in causing the Medo Rog. So the like overeating, guru, or the fatty foods, or the foods which are very heavy to disabilities which are mentioned in Ayurveda are like Ayusharas, that is decrease in lifespan, Javopurat, swiftness in movement, Krichhavavai, Dorbalya, Svedabad, Dorgandha, etc. Then Madhav has also added some different disabilities, or you can also call it as the manifestation because of the Medo Rog, like Shudra Vishwas, Trishna, Moha, Swapna, etc. Then the Upadrav of Sthaulya are mentioned in Ayurveda, like Prameha. As I have told you that we in this study we have tried to see whether there is any kind of correlation between visheshan of Kapha and Pitta dosh. Then these Kapha and Pitta dosh will lead to the Srotorod, and there will be Vata Vriddhi. Then there are 10 factors or 10 dusha which are involved in Prameha, which are responsible for development of Prameha. Then there are complications of Prameha which are mentioned. Then the patients who were sitting for half of the day, like 11 patients, no one was found to do heavy work, because as you know that heavy work will not be, because of the heavy work, there is no accumulation of fat. The type of diet taken by the patients, like starchy food, protein rich diet, or fatty foods, sugars, milk and milk product, was like this. In the family history, it is very much important that the patients have the family history of obesity or Medo Rog as well as the Prameha. In the patients of obesity or Medo Rog and Prameha, that is diabetes mellitus, we have found that the 22 patients were screened for the lipid profile, and we have sent a it was categorized. So 12 patients were found to be in the type 2B criteria. Fasting and post meal are 0.85 and 0.88, which are highly significant, that is P less than 0.001. For estimating the blood sugar P post meal on the basis of known values of cholesterol, triglyceride, HDL, LDL and BMI, the regression equations have been calculated, out of which triglyceride is the most effective blood sugar postprandial, which
because you have taken Western parameters and other things. What was the Ayurvedic part in this study?
Ayurvedic part, what we have tried to assess here was, see what initially I have told you that in Ayurvedic text it has been mentioned that the Medo Rog it is associated with Prameha, as it is mentioned as a complication or Upadrav of the Medo Rog. That we have tried to establish whether what are the actual factors. So initially what we tried that
Ayurveda, as all of know, is eternal science of life, which is old as human being itself. We are really proud of it. We are having very good track record in chronic diseases. Various acharyas and rishis have contributed to this science from time to time. Traditional medicine conference like this is also contributing. 7 have 7 updhatus, like rasa have stanya, rakt have artav, Mans have Vasa, Medo have Swed, Asthi have Dant, and Majja Dhatu have Kesh and Lom, and Shukra Dhatu have Oj as Updhatu. When there were no microscopes, electron microscopes, or modern techniques like today, embryologically, skin is derived from the ectoderm and Mans Dhatu derived from the endoderm. So we cannot correlate both of them. Clinically, as of all we see, If this outer body cover is not intact, we may have like problems of bad sores, wounds and burns, which may be fatal to our life. Dhatu of Twak. In each and every allopathic medicine book, we or
Does somebody have a question?
We have a question.
As when he cites Sar, he cites Twak Sar. So you can give a justification of this also. But rewriting Ayurveda is a very big task.
It has been indicated in daily routine and said that sense of touch depends on the skin and Vata dosha, so it's beneficial for a skin as tail is the most effective to pacify Vata dosha. These are the benefits of Abhyang as stated in classics. There are some font problem. Benefits has been described for the massage of the head, lower limb and ear. These are the benefits of the head massage. Again, there is font problem. The person will never suffer with headache, graying of hair, hair fall and alopecia will be prevented. Bones of the head are strengthened. Hair become strong, black and long. All senses become pleasant. Skin of the face become beautiful. Sleep will be improved and become sound. These are the benefits of the massage of lower limb. It gives the relief from the roughness, stiffness, dryness, fatigue and numbness of limbs. Limbs become softer, stronger and tough of hair. Indirectly nourishes head, neck and mandible region. The overall result is health preservation with a special concern to skin, which is first barrier to prevent any trauma and infection. The oil massage of the skin reduces signs of aging as it improves metabolism and nutrition of the skin. So, last slide is one. Til contains antioxidants, rejuvenate the whole skin regularly. The presentation can be concluded that the ideal lifestyle has been described cleansing and evacuation and the nourishment and the
श्रियंच दद्यात् भवतां पुरारिः यदङ्गतेजः पासरे भवानीं विराजते निर्मलचन्द्रिकायां महोषधिवज्ज्वलिता हिमाद्र. Distinguished chair and co-chair, learned people from different corners of the globe, it's my pleasure to talk before you an Ayurvedic approach in the management of metabolic syndrome. My work has been made easy by Dr. In the same individual, we can consider that he is a victim of metabolic syndrome or syndrome X. It's said here that an abdominal obesity with a waist circumference of 102 centimeter or above in males and over 88 centimeter in females, and a serum triglyceride level of 150 milligram per dl or above, HDL less than 40 mg per dl in men, less than 50 mg per dl in female, metabolic syndrome. If you consider the causes of these, there is a genetic factor. The people having type 2 diabetes mellitus, hypertension and early heart disease have more tendency. The people who are having a tendency to weight gain are more sufferers. It is observed that at least 60% of obese people have a tendency to the Santarpanajanya Vikara, especially Santarpanajanya Madhumeha and Atisthaulia. These are all conditions interrelated and having similar pathological pathways. I'm just skipping this theoretical background. This point we have to consider Medas, the fourth Dhatu, is the culprit mainly playing its role here. One of the understanding that we all have that Medas indicates fat in general and adipose tissue in particular. We do get a term Abdha Medas in our text. The Nidana Parivarjana, Ahara, Vihara and under Chikitsa, Shodhana and Shamana. When I talk about Nidana Parivarjana, we should concentrate on the elimination of causative factors. The causative factors which have already been mentioned there, like sedentary lifestyle and increased intake of heavy sweet substances, they have to be avoided. This is the general principle for Ahara mentioned in Charaka Samhita Sutasthana, Ashtavaninditiya Adhyaya. Let me just highlight a certain food substances or food grains which we have forgotten now. In the modern lifestyle and modern metabolic syndrome, Shamaka, this is a very important drug, Echinoclea colonna. this particular grain, we have also tried to develop some nutraceutical product out of it. You can prepare some rotis out of shamaka, and that can be used as a diet in the patients who are suffering from metabolic syndrome, or the patients who are suffering from obesity, or even in the case of diabetes mellitus. A high protein, low fat dicotyledons. It's a Patola trichosanthus dioica, which is used as a vegetable. At the same time, it is well known for its hypolipidemic property. Amalaki antioxidant, a potent drug in. This drug is yet to be confirmed. Enseta, Shunti, Guduchi, Gugulu, well known for hypolipidemic action because of gugulipids, Vidanga, Triphala, and Agnimantha, a combination of Agnimantha rasa and Shilajatu is mentioned in Charaka Samhita. Shilajatu, in addition to its utility in diabetes mellitus and dyslipidemic conditions, has a fulvic acid, which is the best known electrolyte for human beings, and a number of nutraceutical products are being developed out of it. These are management for this particular condition, metabolic syndrome. These are a couple of references that I had gone through. Thank you for your patient listening.
Does somebody have a question?
Hi. You have done the study on rats, animal study.
Yeah.
It's basically on animal study. And you haven't done anything on humans.
It is done. Unfortunately, what happened is,
Honorable Chair and most esteemed audience, first of all, I would like to thank the Omics group of for giving me a chance to speak over the dais before you people. I'm starting with the subject, random withdrawal, knocking allergies across sectional studies with special reference to Ritu Sandhi. Entire world enjoys the 4 bubbling seasons, but in India, we have got the biological entities. So these macrocosmic entities will be applied to study the prevalence of allergic disorders in a cross-section of almost 1,000 sample population. And there has been a pattern decided how to transfer from one sandhi to another. That transfer should be very gradual and it shouldn't be random. If it is random, it is definitely going to give rise to a number of disorders. And this kram again has been described in another reference by Acharya Charaka, Prakshepapachaitabhyam krama padashinko bhavet ekantaram tatashchurdvam dvayantram trayantram tatha. So this has been period for the 15 days to transit from one ritu to the second ritu. This has been described here, how to transfer from one ritu to another during the ritu sandhi period of the 15 days. Now, Asatmej Vyadhi, the disease resulting because of non-conduciveness of a substance, regimen or therapy to a person. And on the other hand, what is allergy? Allergy is nothing but the incorrect identification, or this is a mistaken identity of an harmless substance. And body immune system reacts in an exaggerated manner to react that particular harmless substance. So these Asatmej Vyadhi and allergies, these have been correlated in the present context. The aims and objectives of the study, the chief objective was that to establish the principle, the Asatmeja hi rogasyu sahasa tyagashilanath, with regard to allergic diseases occurring within the Ritu Sandhi period. And the second objective was to determine the prevalence of different kind of allergic disorders in the specified zone of Jaipur. Materials and methods, a cross-sectional survey study was conducted in a sample population of 1,000 volunteers from National Institute of Ayurveda and other educational institutions by a self-designed proforma. This was done in the 3 Ritu Sandhis, Vasant Grishma, Varsha Sharad and Hemant Shishir. As you can see, the sample population was of 1,000 healthy volunteers. 350 were studied in the Vasant Grishma Ritu Sandhi, 350 in the Varsha Sharad Hemant Ritu Sandhi, and 300 in the Hemant Shishir Ritu Sandhi. This is the sex ratio. 54.8% were females, and the rest were population of the males. This was the particular dietary malpractices observed in the normal population. You can see only 11% population is in the practice of having the pathya diets, wholesome diets, and the rest population was in a constant practice of taking adhyashan, vishamashan, and samashan. So this generally indexes about our poor habits regarding eating. Taste mostly Madhur Ras was found to be very much liked in all the three Ritu Sandhis as compared to the other rasas. We had a general survey, and we just added Vasant and Grishma diets and behaviors, and just have the data. We just tried to generate the data regarding that. How many people? So there was a very poor index regarding. People have almost forgotten about what have been written and prescribed by the acharyas. We live our life in our own style. We are never thoughtful about what our ancestors have told us, taught us. So this was the clear reflection of all that. Only you can see, suppose Kshodra has been indicated in the Vasant Ritu, but only 66 people out of 350 were found to have the Kshodra in this Ritu Sandhi period. So this was a very grave data actually. I realized it. Only Godhum, Madhur Ras, Grit, milk, and Shali rice. These were the things most of the people were taking. Not all the population were aware about that. So this is the definite data. Now this is the Vihar. You can see, I suppose this is the major lacuna in we people, in Ayurvedic people. We are not able to understand our people to make them evaluate the importance of Vaman. Vaman Kam should be done in the Vasant Ritu, but only 6 people. Only 6 people were supposed to do the Vaman, and the Dhumpan you see, only 0. Nobody was keen or interested in such practices. So this was the data we generated, and Divaswapna has been contraindicated, strictly contraindicated, and 208 people among the 350 were found to have the daily Divaswap. So this was the data which was not supporting our prescribed Ritu regimens. It was almost contraindicating. This was the data regarding Varsha and Sharad Ritu Sandhi. Not taking much of the time, you can see. Again, the awareness regarding the diets and behaviors have been very poor. This is Ahar in Hemant and Shishir Ritu Sandhi. Here again, you can see the data. You see Sahasa Tyag Shilanath, we chosen as a principle. So there the question was asked after inquiring about all the procedures, all the queries regarding Ritucharya, how they transfer to another Ritu during this phase of Ritu Sandhi. And it was very discouraging that 68.1% people were on the random withdrawal phase. They were never gradual for these transfers. And this is very important data we got in the general diseases in the Ritu Sandhi period. You see, only 25.3% people were healthy. Rest of the population were found diseased in the Ritu Sandhi period. Among these, 33.4% were found suffering with the allergic diseases, 19% same diseases with the non-allergic cause, and 22.3% people with the other systemic diseases. These are the different kind of allergic diseases in the different Ritu Sandhis. You may see that allergic respiratory diseases are on high in all the 3 Ritu Sandhis, and the second allergic skin diseases are seen there. And there was always a mixture of symptoms. Very little population was found suffering with a single allergy, single system of allergy. Respiratory skin allergies were found associated. altogether. And among these 550 volunteers, those were found allergic throughout the year. 334 volunteers were found triggered their allergic episode in particular Ritu Sandhi period. So this has been the data defining again the allergic respiratory diseases, allergic skin diseases, food allergy, respiratory plus skin allergy. So these are the 334 volunteers who have the triggered allergic response is in particular phase of these 15 days of Ritu Sandhi. So totally result I can define now, total volunteers were 1,000 and diseased population was 747. This is a very grave consequence of my cross-sectional study that totally reflects the health status of our society. Only 253 people were found healthy and rest were found diseased. And among those diseased, you see 334 persons were found allergic in that Ritu Sandhi period. Non-allergic was 223 and other systemic diseases sufferers were 190. Discussion as per the formulation of hypothesis asatmeja hi rogasyu sahasa tyagashilanath in the manifestation of allergic disease of different srotas, that is pranavaha, rasvaha and annavaha srotas, the results were quite relevant and encouraging. 68.1% sample population was found in practice of random withdrawal of their outgoing Ritu, and almost similar proportion, that is 747, was found suffering with disease in general and 334 with allergic diseases. In general, out of 1,000 healthy volunteers, 25.30% volunteers were found healthy and 747 volunteers were found unhealthy. Out of diseased population, 73.63% means 550 volunteers were found suffering with the different kind of allergic diseases, and 197 were of other kind of systemic diseases. In all the 3 Ritu Sandhis, maximum number of patients were of respiratory allergy. This clearly indicates the presence of Shita Guna in the manifestation of the disease. Conclusion, I am concluding. These days people are in practice of random withdrawal. I got the data for 67.71% intake regarding transition from one Ritu to another. Out of 1,000 volunteers, 747 were found diseased. In general, out of 1,000 volunteers, 550 were found suffering with different kind of allergic diseases throughout the year. And 334 volunteers were seen with the triggered allergic response during these Ritu Sandhi periods. Thank you. Thanks for the patient here.
Does somebody has a question?
Doctor?
Yeah.
First time seeing these allergy-related problems here.
Yeah.
Allergy-related respiratory problems you were talking about.
Yeah.
So I am now a patient of asthma for the last about 45 years.
Okay.
I have divided exercise by which you see allergy problems, asthma, COPD, cystic fibrosis, all can be brought under control within minutes. That is my concept. So now at the age of 75, I am able to sleep without any symptoms of asthma. I am presenting papers international conferences, AIMS, WHO, US, and also I am present here. Tomorrow I am going to present my concept. So my concept of this treating of allergies and allergic asthma, COPD, may be helpful to our fraternity, and this may become a complement to all others, all your practicing, doctors. So I request all of you to watch the video. I have got videographed for the exercise by which the respiratory, the pathological feature of the respiratory diseases, hypersecretion of mucus can be brought out. The mucus can be drained out within minutes. The whole of the respiratory passages, including upper and also tracheobronchial tree, they get cleaned within minutes. So this exercise I am showing tomorrow. Please you can see, and as compliments you can use it. Thank you.
Hello. Actually, madam, one question from me.
Yeah.
How you diagnose that allergic manifestation?
I have not put the slide inside. Actually, we were screened the patients of 3 allergies. Respiratory allergies included respiratory rhinitis, allergic rhinitis, and allergic asthma patients, and even allergic bronchitis also. And in the skin patients, they were the pruritus, hives, rashes of the allergic cause, and food allergy.
How you define allergic cause? Are you test allergen test?
No, it was not possible in the survey. It was not. This is a pioneer study I have made in my. I am generally very curious to generate data regarding there are a number of hypotheses, in the text that we do always in the theory, vegan dharaniye and adharaniye vegas, this dincharya, ritucharya, but we are not able to propagate Ayurveda in proper manner. I think we talk in the terms of globalized Ayurveda, but even is very poor for us actually. For this is a great part on our side. Thank you.
Please collect your certificate from our
Thank you, Dr. Nisha. Huge round of applause for her, please. Now I would like to, I'm sorry, we have a little change in the schedule. We are inviting Dr. Vaidya Mita Kotage for her presentation, which was not scheduled today. But we welcome her very much. Please a big round of applause for her. She's from National Institute of Ayurveda.
Respected chairpersons and learned audience, I presented a topic a comparative study on barley and oats and its effect on weight loss and nutritional parameters. Nowadays, changes in dietary practices, lifestyles, along with reduced physical activities rising with influence contribute to increasing prevalence of overweight in all the age groups of society. Obesity has reached epidemic proportion in India in 21st century, with morbid obesity affecting 5% of the country's population. The National Health Foundation of India undertook a study amongst the higher middle class, lower middle class in a large office establishment and amongst the poor class from a slum in Delhi. As against obesity of 1% for male and 4% for female in slum, the corresponding figure in the upper middle class and middle class together were 32%, 32.3% and 50%. More females than males have been found to be overweight in all age groups, 44.5% in females versus 19.6% in male. Incidence of obesity was higher in people above 40 years. The prevalence of obesity was about 3% in male and about 14% in females above 40 years of age. 20 million Indians are obese and by 2025 expected number of 68 million. Obesity existing when adipose tissues compresses greater than normal functions of body weight. The measurement of body fat is too complex to be of practical clinical application. Hence, measures such as critical index, also known as BMI, are used in daily practices. The World Health Organization guidelines define a BMI of 18.5 to 24.9 kg per square meter as normal, 25 to 29.9 kg per square meter as grade 1 overweight, and greater than 30 kg per square meter as grade 2 overweight. With this in mind, the International Diabetes Federation has accepted BMI value of 25, greater than 25 kg per square meter and 23 kg per square meters as a cutoff of obesity for Asian men and women respectively. So for the present study, the patient having BMI greater than 23 are included. With the current back to nature thrust, many obese patients also look for some help from traditional systems like Ayurveda. Traditionally, obesity was believed to be associated with lifestyle. Several studies have shown that changes in dietary pattern, physical activities levels, lifestyles, and related to increasing function frequencies of obesity and the risk of associated diseases. Present work was conducted on barley and oat, yava and jai. Many preparations of barley are reported for wide use of weight reducing diet like sattu, laja, etc. Ayurvedic texts prefer yava over jai because oat is considered as a kudhanya. Indices of B recorded measures, body fat measurements. Biochemical, several biochemical parameters like blood glucose, total cholesterol, HDL, LDL, VLDL, triglyceride were assessed. Trial durations 8 weeks. Usage of both Yava and Java, you can see in all results, you can see Yava is more effective. Discussion. By comparing this result, we can say that both Yava and Jai were having Lekhana effect and can be used as anti-obesity diet in routine. During this study, no any allergic condition or side effects were reported by subjects. Effect of Yava and Jai on anthropometric parameters and laboratory parameters shows that there was a statistically significant improvement, but Yava is found to be more effective in both parameters. And in Alasya, Daurbalya and Yava also improvement, but the flour of barley and oats, barley flour significant in reducing serum cholesterol, serum triglyceride, VLDL and LDL. Although chapati from oat flour also showed significant result, but barley is found to be much better than oat. Therefore, we can say that barley is effective on inhibition or prevention of various diseases caused by uncontrolled adipogenesis and lipolysis. Thus, barley and oats can be used in following disorders as a pathya ahar. It is also mentioned as pathya in many Ayurvedic texts. This study proves the indications of Yava over Jai is mentioned in many Ayurvedic texts. It is to be noted that oats are more popular due to better marketing and barley is actually more effective. Many modern texts also describe that oats should not be used as the sole article of diet for the long time, even with the addition of milk. An account of this tendency to produce a skin eruption due to the irritating qualities of avenine, one of its ingredients. So it is advisable not to use oat for a long time. Thank you. Thank you very much for listening me. Can I ring?
We'll be taking a few questions on Dr. Vijay's study. Madam, the roti of Yava and Jai was the only thing given to the overweight persons? Only one roti?
No, not only one roti. 150 gram flour.
In addition to his
3 roti.
No, okay, 3 rotis. In addition to his normal diet.
Yeah.
Okay.
Except gehu roti, this Yava roti we prepare.
Thank you very much, Dr. Vaidya. Please collect your certificate. We have one more question, ma'am, for you.
Madam, you mentioned 56 patients. You included 56 patients. So how you did the sample size calculation for this one? What was the primary outcome measure? From where? From where? Like how you calculated the sample size? Like 36. Like 36. It can be Moonrat 200, 500, 600,000 maybe. Yeah, sure.
When we are talking about the power of the study, when we are asking for the sample size calculation, it's a huge calculation. And the minimum when you get it is not less than 3,000 for a study like that. So it is not technically possible to carry out that kind of study.
No, sometimes you can get 100, 200 maybe. It depends on your primary outcome. There are certain criteria, type 1 error, type 2 error, other things. Yeah, sure.
Thank you, Dr. Vaidya. We are now breaking out for a coffee session. We'll be back sharp by 4:25. I appreciate all the speakers who have been with us. Also, I would like to call upon the names of the speakers who have their slots in the next session. Please submit your presentations with me. It's Dr. Meenakshi Paul from National Institute of Ayurveda. Dr. Narayan Jadhav from Dhanvantari Ayurveda Medical College. And Dr. Manish D. Gundhav. Thank you, everyone. We are resuming our session. I hope you all enjoyed your coffee break. The first speaker after the post-coffee break is Dr. Umakant Patnaik from Dibadhama Hospitals. Okay, I think he's not here. We'll postpone his presentation. Next, we have Dr. Archana Singh with us. Do we have Dr. Archana Singh? Dr. Archana Singh, your presentation. Please welcome her.
Good afternoon to one and all. Myself Dr. Archana Singh, final year PG Prasuti Tanta Anesthetist from SDMCA Hassan. Actually, I have done one small survey study on how the local people traditionally using after postnatal practices. Then introduction. As we know, folklore medicine is an integral part of the ancient civilization like India. And traditional practices have been carried over through the generations. And folklore plays a major role in the postnatal care, prevention, and the cure of the diseases of the perpetual woman. And the material and method, as I told, I did this small survey. So I just collected data from the interview method from the 30 subjects from the different parts of the India. These are the Karnataka, Kerala, Rajasthan, Maharashtra, Uttar Pradesh, Bihar, Haryana and Chhattisgarh. In that, I have taken maximum data from the Kerala and Karnataka, as I am studying here. So, and from others, like I am from UP, so maximum from Karnataka, Kerala, then Uttar Pradesh. Other on phone are my some friends, colleagues. And these data were collected from the women either who has practiced or experienced in the folklore practices. Then in that, what I observed, like that experienced lady, women, subjects, some I found that common observation and little bit differences in that. So the common practices which I found there, like pattern of rest and sleep after that delivery, all are practicing of the rest and sleep, and Ushna Udak Upchari, use of the hot waters for all the purposes like external and internal uses, and massage. Generally, they are having maximally practices of the massage from the next day of the delivery, but some having the practices after 10 or 15 days, as their thought like after delivery the lady is not that perpetual woman that not having too much strength to bear down the strength of the massage, so they are having practice of the massage after 10 to 15 days. And they are using some oil medicated with different drugs according to availability and their satmya. That oil they are generally using coconut oil, arand oil, and tilatela, and medicated with either haridra, krishna jirika, or the garlic, as I told, according to availability. And also they are having practice of the yoni prakchalana, like douching, yoni dhupan, fumigations, that separate rooms for lady, which the special type of room, like that room is little darker, quite calm, that away from the reach of the common other peoples, and a special type of the cord, maximum people they are having weaving cords. In that holes is present, so they used to that cord for the fumigation or the dhupana of the whole body dhupana. And hot water bath, in some places they are having practice of the forcefully that throw of the hot water in the back and the lower abdomen. Especially these practices are Kerala and Karnataka. And these are the some drugs which they are maximally using either for the external or internal. And these are the some drugs which they used to go the medical shop, and without any prescription they are only buying and using. and some they are all are following these type of the diets, like they are using light diet and less quantity of diet and water, as they are thinking like if they will give the more water and more diets, so it will increase the girth of the abdomen. And maximally they are giving the rice with the pepper saru, rice with the old jaggery or grita, payasa with the jaggery, variety of the sweets, and they are using less salt and more of the jaggery like sweets item, and the tambula sevan, as they are thinking also, as we also knowing in Ayurveda, it's helpful to reduce the adhyamana. And they are using most of the milk and greta. And as I told, there is some differences in practices among 30 subjects. I just differentiated these things, like postnatal period, the Sutika Kala. Among 30 subjects, some have practiced up to 1 month. That Sutika Kala means they are following the regimen of that do's and don'ts up to 1 month, some up to 1.5 months, some 2 months, some maximally they have practiced up to the 3 months, and some up to the 5 months. And massage, as I told, among 30 people, maximum like, actually that is 25. 25 subjects have practiced the massage, and 5 subjects have not practiced of the massage. And bath day, here I found like more variation. Some have practiced just the day of the delivery, some first day, some second day, some 6th day. And some people like they are having practice of the bath after 10th day, means after 11th day they will give the bath. Up to 10 days they won't give the bath at all to the lady. And use of the abdominal binder, Udarpatta Bandhana. In that, like in the 30 subjects, what I found that some subjects have not applied the binder, and some have applied up to 1 month, 2 months, 3 months, and some up to the 5 months. And intake of the meat soup, like some have practiced the non-vegetarian, they were having the practicing of the intake of the meat soup, and but nobody have used before 4 days. Because in Ayurveda also have told that initial 5 to 7 days they are not giving the meat, so mams rasa prayog. And then the discussion, as previously I told, there is some similarity and dissimilarity. So that which I found in that survey, that these Sutika Paricharya, or that postnatal regimen which the common people traditionally they are following, that is the modified adaptation of the methods which explained in the Ayurveda. I'll little bit elaborate how, and but some there is differences in practices due to the availability and the satmyata. As I told, they are maximum they are using the Usna tincture like pepper and all, and Ayurveda also it's mentioned Panchakol Siddha Mahati Matra, and Snehapana and Anupana with the Gudodak or Vata Rausada. Because as we know, these having the property of the Vata Samana, Shula Prasmana, and it's cured the delayed GI motility, and it's also having the Ampachan quality. And other like plenty of the milk and the greta, it's also mentioned in our like medicated Yavagu with Sneha and Milka. It regulates the synthesis of the milk, synthesis and secretion of the milk. And the use of the meat soup, as I earlier told, nobody have practiced before 4 days. So in Ayurveda also mentioned after 7 days or 12 days they are mentioned, they have quoted the use of the meat soup, mams rasa. As we know, mams rasa, the pridananas, it's helpful in the regeneration of the endometrium. And other, it's also the mamsa, it's helpful to the regeneration of the other all the dhatus. And abhyanga with balatela, like it's mentioned in Ayurveda, but local people, they are using the different oil. As I told, coconut oil, eranda, or til tela, medicated with the haridra and all. So it's helpful to the abhyanga. It's helpful in the physiological changes like involution of the uterus, cervix, vagina, pelvic floor, pelvic fascia, etc. And also it relieves after pain on the peripherum and backache. And Ushnaudak Parishek Swedesnana, we use of the hot water, as Susruta has mentioned, Prabhutain Ushnaudiken Parishinchet, means for postnatal care, he has mentioned use of the good quality and quantity of the hot water, and this is helpful in the Parisisched Dharaya, Garbh Chobakrit Rakta Sravanat Vat Jayart, like the pain and all which is due to the Garbha, it's helpful to relieve that, and also Vata Shamana. And abdominal binder, that Udar Patte Bandhana, by this it is helpful to the, by this the loosened abdomen reaches its proper place, and the Vayu also subsides. And it gives support and strength to the abdomen, and also we know just western is the one of the Vata Upkramam. As we know that Sutika postnatal period, it is the condition of the Vata, means Vata Visheshan and Agni Mandeta. So in that condition we should protect her Vata, and also we should care about her Agni. And fumigation or dhupan, Susruta mentioned Vedana Rakcho Ragnair Dhupayed. Means it is that dhupana, it's helpful in, it's having the property of the Vedana har and Rakshashar, like analgesic, and Rakshas means antimicrobial and antiseptic property, and also it's Vrad Dorgandhi Apgamartham Neel Makchikadi Pariharartham cha. It's avoid the bad odor of the like episiotomy wound, other places, and also it's avoid the Neel Makchikadi insects. Then I would like to conclude by these words that adopting the Sutika Paricharya explained in the classics and creating optimum awareness can give an authentic outlook to the traditional Indian practices with a special reference to postnatal care. Like as I told also, they are practicing some which they should not practice, like some are not practicing the abdominal binders, and some are not giving the bath up to the 10th date. Maximum they are practicing good things. Errors is there. So we can educate them, and we can make it the good. Thank you.
Does somebody like to ask a question?
Thank you, Dr. Rachna. Now, please collect your certificate from the chair, co-chair. Next on stage, we have Dr. Narayan Jadhav from Dharmantri Ayurveda Medical College and Hospital. Pen drive. Do you have your pen drive? It is PPT format.
Good afternoon, everybody. Respected chairpersons, dignitaries on the dais, and all the delegates coming from all over the globe. My topic of presentation is rheumatological disorders in Ayurveda. Introduction. We all know Ayurveda is the science of life and one of the oldest system of the medicine in the world, which deals with the promotion and maintenance of the positive health of masses. Now my topic is rheumatology. Rheuma, it means that which flows as a river. It is a Greek word, and logic to study up. It is the branch of medicine which mainly deals with the joint disorders, including articular, periarticular structure, that is diseases of joints, muscles, bones, soft tissues, which includes bursa, tendons and their synovial sheath, entheses and fascia. Fine tuning of the body movements make a skillful human life. The degree and range of the articular movements decide the freedom of location. Now, these conditions, national scenario of these conditions, the common modes of therapy for rheumatological diseases in India, for Ayurveda, 55% patients are coming for Ayurveda and response is 19%. Homeopathy 55% and also response is also 19%. Allopathy 51%, response is 79%. Unani 13%, response 23%. Diet 25%, response 60%. And other, that is faith healers and folk healers, are 20% and 28%. But in allopathy, the patients are receiving treatment without supervision, that is the steroids, corticosteroids and disease modifying drugs. Now, need of study. Most of these conditions are due to altered immune mechanism, persistent antigenic stimulation in the genetically predisposed persons, and change in the lifestyle. These are very distressing due to its chronicity, morbidity, crippling nature, and absence of effective treatment modality. It attracted the researchers of different traditional medical systems. Now, rheumatism and their possible Ayurvedic correlates. Modern diagnosis: rheumatoid arthritis, Amavata; osteoarthritis, Sandhivata; gout, Vatarakta; cervical spondylosis, Grivasthamba, Avbhavuka; lumbar spondylosis, Katishula or Gradrasi; ankylosing spondylitis, Dandak; chronic low back pain, Katishula; frozen shoulder, Avbhavuk; sciatica, Gradrasi; effusion in joint, Krostuk Sirsha; temporomandibular dislocation, Hanugraha; ankle sprain, Vatakantaka; thoracic outlet syndrome, Vishwachi; osteoporosis or osteomalacia, Asthigatvata; fibromyalgia, Sarvangaгаtvata; quad equina syndrome or lumbar disc disease, Gudagatvata; and wasting of stabilizers, Aunsh Shosha. Reasons for increasing of the patients towards Ayurveda are unavailability of potential therapy in conventional medicine, natural stable course of the disease, poor explanations and attention to patients in conventional OPD, poor compliance of the therapy due to cost or side effects resulting in poor responses, seasonal variations in disease or symptoms intensity causing confusion in understanding the effectiveness of the therapy, possible higher effectiveness of Ayurvedic therapy. There are some conditions associated with arthritis patients coming towards Ayurvedic OPD. These are: patients are coming with pre-diagnosed state, progressive nature of disease, associated complications, economical instability, reduced family support, previous trial of multiple therapies with unsatisfactory result, lack of faith in therapy, believe in mystical cure, regard the explanation about the disease, disregard, reluctant in compliance, and disabled require support of someone else to come for treatment. Now, basic principle of treatment in Ayurveda. All of we know the Ayurvedic approach to prevention and cure swings around two broad aspects. That is Nidan Parivarjana, elimination of the cause of disease, Samprapti Vigatana, reversal of pathogenesis. The chronic disease is to be treated in a comprehensive manner if a real cure is to be achieved, in which Ayurveda advocates for Samshamana, pacification or palliative management of disease by administration of drug, diet and lifestyle modification, and Samshodhana, curative detoxification of the body from organ to cellular level. This is a unique concept of Ayurveda. Now, coming towards the therapeutic aspect, non-pharmacological treatment for these conditions: rest and exercise, physical therapy, panchakarma, dietary modifications, psychotherapy, patient's education, and lifestyle modification. Pharmacological treatments: external treatment, application of analgesics, application of tissue nourishing drugs. Now, internal treatment: symptomatic therapy, disease modifying therapy, and antipathogenic therapy. Some golden rules for exercise in joint disorders. Rest and exercise should be critically evaluated before their prescription. no prolonged bed rest, no bed rest in especially RA and ankylosing spondylitis, no exercise during acute stage, no excessive exercise beyond the tolerance of the patient. Follow the instructions of do and don'ts, that is patya patya. Adherence determines the outcome. Home-based and hospital programs are equally effective if adhered properly. No exercise. Food promoting kapha with affinity to joints should be of low calorie value in obese people. For ankylosing spondylitis, promoting vata and kapha is not recommended, and food which may reduce ama, kapha and vata is recommended. Now pharmacological treatment generally used Gugul preparations, Amritadi Gugul, Abha Gugul, Kaishora Gugul, Punarnavadi Gugul, Pancha Amrut Gugul, Mahayograj Gugul. Rasa preparations, Amvatari Ras, Khanjanikari Ras, Trimurti Ras, Vat Gajankush Ras, Vat Kantak Ras, Vat Vidwansan Ras, Vatari Ras, Rasraj Ras, Rasamanikya, Naradiya Lakshmivilas Ras. Some factors influencing the selection of therapy. It depends upon the chronicity of the illness, old age, multi-system involvement, coexisting illness, concomitant and concealed use of other drugs and medicines, high cost of treatment, unpredictability of response, and unstable nature of disease, and seasonal flare-ups. Now some are statistical examples are here. Diagnosis-wise, incidence of rheumatological cases in 632 patients. RA cases are 130 for osteoarthritis, 201 vertebral disc lesion, that is the cervical and lumbar lesion, 202 ankylosing spondylitis, 5 patients, frozen shoulders, 25 patients, and gout, 11 patients. Incidence of chronicity-wise cases, chronicity in years, 1 to 5 years are found 210 patients, 6 to 10 years, 128 patients, 11 to 15 years, 205 patients, and 16 to 20 years, 32 patients. Sex-wise distribution, male are found 319 and female are 313. And treatment-wise, for Panchakarma or Shodhana treatment, 421, and palliation or Shamana treatment, 211. Now coming to the conclusion. For the rheumatological conditions, since past 13 years, I am treating all these cases. I am conclusion with this, each and every case should be identified, determination of treatment objective of the particular case, patient-centered communication strategy should be formation of self-help groups, promotion of group activities among the arthritics, counseling regarding the matters apart from arthritis but causing a concern to patient, personal, social or professional life, economical feasibility of support services, education and counseling of a spouse or immediate caregiver or kin of the patient. Personalized care should be taken. Education to employing people with arthritis or our paramedic staffs, and appreciation of acts and skills shown by the arthritic people. Thank you. Thank you very much.
Somebody would like to ask some questions to sir? Sir?
Hi, sir. Yes, sir. Yes, sir.
Allopathy and Ayurveda. What was the source of that data?
Sir, there are some books, sir. Internet and books. This one is from Dr. Malvi and et al. Reference is from Basic Principles and Treatment of Rheumatology book. Dr. Sanjeev Rastogi. Writer is Sanjeev Rastogi. I think Lucknow. I think Lucknow. Okay, sir.
Dr. Jadhav, you mentioned for the osteoarthritis we have to give kapha promoting and low calorie diet. Can you give 2 examples which are kapha promoting and low calorie diet for the osteoarthritis? You mentioned in the slide.
Yes. Yeah.
Should be of low calorie.
हो. हाँ.
Kindly excuse me the hall, because he is well versed in the Marathi language, so I will speak in Marathi and then later on we will communicate. कफ वाढवणारा आणि कमी कॅलरी असणारे असे 2 आहार पदार्थ सांगा तुम्ही.
कफ वाढवणारा.
हाँ. आपने लिखा है ना कफ बढ़ाना चाहिए और कैलोरी कम होना चाहिए, ऐसे 2 आहार द्रव्य बताइए. आप बता रहा हूँ मैं.
सर ये आहार द्रव्य पे मैंने स्टडी नहीं किया है, ये रिकमेंड करने के लिए बताया है.
हाँ, वो रेकमेंड
और
कैसे करेंगे?
मेरे जो एग्जांपल्स अभी जो ये है 632 पेशेंट्स, आई हैव प्रैक्टिसिंग सिंस 13 इयर्स. हाँ. हाँ. डाइट में तो रूटीनली लेते हैं सर हमारे पास डाइट. ऐसा स्पेसिफिक डाइट हम रिकमेंड नहीं करते. या Yeah. Yes, sir. Yes. We are not any actual following. We are giving routine diet है sir. चपाती रोटी सब्जी है वो routine. Yes. Yeah.
Simultaneously, they are less in caloric value. So, what diet you are giving as a cough promoting and less calorific value?
In our setup, patients are using. Yes, sir.
What you are prescribed?
जवार रोटी प्रिस्क्राइब करते हैं सर. जवार रोटी रहता है हमारे पास ज़्यादा.
Sir, I'm sorry for interrupting. I'm really sorry for interrupting, but for the smooth running of the event, can we continue with the program? And
Okay, sir.
I can understand, sir, very much.
He already told he has not done this. Why do this thing? Because all this data is taken from the
Sir, please coordinate with us. And for the smooth running of the event,
Okay.
please coordinate with us. Thank you so much. So please collect your certificate from the co-chair. Thank you very much, Dr. Narayan. We really appreciate your talk. Next we have Dr. Aparna from University of Peradeniya, Sri Lanka. Please welcome her on stage with a big round of applause.
Good evening, everybody. My presentation is based on mineral constituents and antimicrobial activity of 3 Rasashastra formulations. I'm Apsara Vijayanayaka from University of Peradeniya, Sri Lanka. As most of us know, Rasashastra drugs are pharmaceutical preparations consisting of plant and mineral materials. In Ayurveda medicine, minerals are processing by some special ways to enhance their pharmaceutical qualities and to remove their toxic nature. These mineral-based preparations are in practice more than over 5,000 years. but how there are only few scientific studies have been carried out to evaluate their techniques and to determine their mineralogical and chemical properties, and also to determine the possible pharmaceutical applications as well. Therefore, study of rasasastra preparations are important. Further, antimicrobial studies of new sources of plant and mineral materials are important due to the development of resistance of antimicrobial activity of allopathic drugs. Therefore, this study focused to analyze 2 commercially available herbometallic drugs and 1 drug prepared in the laboratory. Then the objectives of the study were to assess mineralogical, geochemical, and antimicrobial properties of 2 commercially available herbometallic drugs and 1 laboratory prepared drug. Then the methodology in brief: 2 commercially available mica-based drug samples were purchased. One is from Indian Dabur Company and the other one is from Sri Lankan Traditional Ayurveda Center. The drug, which had significant organic matter, was fractioned into their organic and inorganic materials using a sequential extraction procedure. And another mica-based drug was prepared in the laboratory using biotite mica as the major ingredient, and jaggery, Ficus bengaliensis, and Ricinus communis leaves also used as organic materials. Then the cow's urine was used as the animal byproduct. All the heating, quenching, and incineration steps were carried out as in the traditional textbooks. Then the structural and mineralogical of all 3 drug samples were qualitatively determined using XRD and FTIR. Mineralogical, geochemical properties of acid-digested drug samples were quantitatively determined using atomic absorption spectrophotometer. Then the organic content and moisture content of all the drug samples were determined using thermogravimetric analysis. Antimicrobial activity of all the drug samples and their extracts were qualitatively determined using modified diffusion, well diffusion, and agar dilution methods. These are the 3 drugs used in the study: Manikya Rasa, Abraka Bhashma, and Abrak Bhashma prepared in the laboratory, hereafter described as MR, AB, and ABS. Abraka Bhashma self-preparation technique. Fresh biotite mica was used as the major ingredient. Then the biotite was heated up to 1000 degrees Celsius using a muffle furnace. Immediately after heating, quenching was done using cow's urine. This heating and quenching process was repeated 7 times to complete the detoxification steps. Then the detoxified mica particles were mixed with paddy husk and tied up in a cloth. Then the entire mixture was dipped in vinegar for 3 days. Then the fine particles filtered out from the textile was collected and mixed with jaggery and Ricinus communis water extract. Then the pellet was kept until air dry, and the dried pellet was placed over the Ficus bengaliensis leaves. Then the entire mixture was sealed and burning again in the muffle furnace. There the temperature was 1000 degrees Celsius. This organic matter addition and incineration steps were repeated 10 times to get the final drug product. These are the components used in antimicrobial analysis. Manikya Rasa drug, its hexane extract, its dichloromethane extract, and its methanol extract. The inorganic residue of the Manikya Rasa that consists almost of mineral materials. Then the Abraka Bhashma, commercial and self-prepared samples were used in their solid form and also as suspensions in DMSO for the antimicrobial test. Then the plant constituents used for the Abraka Bhashma preparation also tested for their possible antimicrobial activities using water and ethanol extracts. These are the microorganisms used in the study. Most of them are skin pathogens: Staphylococcus aureus, MRSA, Pseudomonas aeruginosa, E. coli, and Candida albicans. Now I'll move on to the results and discussion part. First, the structural and mineralogical studies. According to the XRD spectrum of Manikya rasa, that was consist of many minerals, including biotite mica and metacinnabar, cinnabar, arsenolite, sphalerite, and chalcopyrite-like mineral materials, and their altered fragments. Then the structural and mineralogical studies of AB and ABS drugs. According to the XRD spectrum of abracabashma, that was consist mainly of biotite mica and some amount of hematite. Then the abracabashma self-prepared also showed the similar spectrum, but it had additionally magnetite and altered mica minerals as well. Then the Fourier transform infrared spectrum studies for the abracabashma two set of samples, and with that it was revealed that iron oxides are forming as a result of thermal changes during the preparation. This table summarizes the mineralogical constituents of 3 drugs. MR is consist of biotite mica and 5 or more other minerals, and abracabashma and abracabashma prepared in laboratory commonly had biotite mica and hematite. In addition to the commercial biotite, self-prepared biotite had magnetite and clay minerals. Most of the iron oxides and clay minerals have been formed as a result of alteration of thermal steps carried out. Then the geochemical analysis of Manikya rasa drug, that was consist mainly of iron and sodium, and compared to the initial concentrations of raw materials, the trace element concentrations are significantly lower. Then the geochemical analysis of abracabashma commercial sample, there also the iron concentration and sodium cation concentrations were significantly high, and compared to the raw biotite material concentrations, there are also the trace element concentrations are significantly lower. And similar results was obtained for the self-prepared abracabashma as well. Then the thermogravimetric studies for Manikya rasa. Manikya rasa consists nearly 70% of organic material, while both 2 types of abracabashmas are having only 4 to 5% organic materials. Next, I'll move on to the antimicrobial results. First, for the Manikya rasa drugs and ethanol extract, and its all 3 extracts were active against at least 2 or more tested bacterial species, but none of them showed activity against the Candida albicans. Then the abracabashma and ABS, both drugs didn't show any sort of antimicrobial activity for the tested organism with the selected methods. But the Ficus bengaliensis that was used for the abracabashma preparation showed the good antimicrobial activity against MRSA and Staph aureus in its water and ethanol extracts. But the Ricinus communis didn't show any sort of an activity for the selected microorganism at the 10,000 ppm concentration level. Then the summary. Mineralogical constituents of Manikya rasa consists of mica and several minerals, and abracabashma commercial sample consists mainly of biotite mica, but the self-prepared abracabashma consists altered biotite and iron oxides. Microbial activity of drugs. Among the 3 drugs, MR was the most active, and AB and ABS were inactive. Manicurasa drug and its residue, which consists significant inorganic material, were active against all the bacterial species. And all the 3 drugs were inactive against Candida albicans. Then the antimicrobial activity of extracts. Manicurasa methanol extracts was the most active extract among the tested extracts. Then the different components of Manicurasa and Ficus bengaliensis showed activity against 2 or more bacterial species. With the tested components, all the tested components were inactive against Candida albicans. Then the conclusions and future directions. Herbo-mineral combinations in Manicurasa has an antimicrobial activity compared to mica as the major ingredients. The herbo-mineral combinations present in Manicurasa and Ficus bengaliensis leaves may have the potential to serve as alternatives to allopathic drugs. Then my acknowledgements to financial assistance by the Higher Education for 21st Century grant and the International Research Council of the University of Peradeniya. Thank you for listening.
Rationale behind your this study? What you want to convey from your study?
Yeah, most of that Rasa Shastra preparations are not spreaded in Sri Lanka, unlike in India. It's very rare and randomly distributed. Even that distributions are not in use because they are afraid to use Rasa Shastra preparations because most of people are believing that they are toxic. And therefore, I need to evaluate these techniques and check whether that concept is correct or not. And
how many samples you have tested from different batches?
Yeah, every sample had 6 more than 3 repetitions. Yeah, statistically justified.
Yeah, I congratulate you for your very systematic study. It's a very excellent study. I congratulate you.
Thank you.
Thank you, Dr. Aparna, for your wonderful presentation. Please collect your certificate from the chair. Next, we have Dr. Anita Sharma from National Institute of Ayurveda for her presentation.
Respected chairperson, co-chairperson, and my colleagues, today my topic is clinical evaluation of the effect of Sapsam Yoga and Mukh Kanti ka Lep in Mukh Dushika with special reference to acne vulgaris. Introduction. Teen years are the most challenging and exciting years of the one's life, where social acceptance and peer pressure play a major part in the teen's self-image. And since our face is said to be the mirror of general health, it is important to pay attention to this part of the body, and the most common element that a teen suffers in this age is acne. The main reason why this disease has been chosen is because of its common prevalence and the effect it has on its patients, because this disease makes an impact on patients' psyche and social life in spite of being a somatic disorder. In acne, too, it is seen that its patients often develop depression and low self-esteem. In Ayurveda, this disease is described as Mukh Dushika or Yuvan Pidika. It is also called Tarunya Pidika. शाल्मली कंटक प्रख्या कफ मारुत शोणिते जयंते पीडिकाम यूना वक्त्रया मुखदूषिका. According to Ayurveda, the Shalmali thorns like eruptions on the face due to vitiation of cough, vat and rakt, which are found on the face of adolescents are called muktushika or yuvan pidika. Aims and objectives: clinical evaluation of the internal medication Sapsam Yog and topical preparation Mukh Kantikar Lep in the management of muktushika. Nidan, the causative factor of muktushika may be divided into following major groups: aharaj, viharaj, mansik karan, kal, other side effect of various treatments or by use of cosmetic, etc. Samprapti, drug review. In many ailments, poisonous drugs prove more efficacious than normal prescription drugs due to their inherent properties. Poisons have 10 inherent properties which are responsible for their fast action and tissue penetration. And so, if the poisons are used in refined and minuscule amounts, then their action can be controlled and steered in desired way. This can be understood by the shloka. Visham pranharam tacha yukti yuktam rasayanam. Two poisonous drugs, bhallatak, an organic irritant poison, and manashila, an inorganic irritant metallic poison, are used in the oral and topical trial drug respectively. Both drugs have found mention of being worthy in treating skin conditions. Oral drugs Sapsam Yog, Tilajya Trifla, Kshodra, Vyosh Bhallatak Sharkara, Vrashya Sapta Samomedhya, Kustaha Kamcharinah. Topical drug Mukh Kantikar Lep, Matulung Jata Sarpi, Shila Go Shakrato Rasah, Mukh Kanti Karo Lepe, Pidika Til Kaljit. Sapsam Yoga and Mukh Kantikar Lep. Mode of action: as we know that total freedom from this disorder is not possible without rectifying the internal problems. This trial was made up of a topical treatment, Mukh Kantikar Lep, and an oral medication. Sapsam Yog, the oral drugs of 7 drugs cumulatively having Tridoshar, Katu Tikt, Kashaya Ras, Kramigna, Yakrat Uttejak, Deepan, Pachan, and Kustagna properties. The Mukh Kantikar Lep has 4 drugs overall having Katu Tikt, Kashaya Ras, Bhuto Padrav Nashak, Varnya, and Vishapahagun. The Katu Tikt, Kashaya Ras, Ushna Virya, and Deepan Pachan Gun of the oral drug, which are Kaf, Shamak in nature, it also ignite the Jatragni, which correct the disturbed physiology. Many herbs of his formulation have the Kramigna action, which checks the action of bacteria. Apart from the above mentioned gun of the drug, Lekhan, Laghu, Ruksh, and Tiksha Guna of the drug curb the Ati Snigdhata gun in the body. It checks the oiliness of the skin, which provides a dirt and green-free surface. The Kashaya and Madhur Ras and Sheet Viri of the drug rectify the vitiated Rak Dosh. The Shothar and Shrotoshodhak properties of the drug treat the blockage of skin pores and their inflammation also. The drug has also Kustagna, Varnya, Twachya, Vranshodhak, and Vranrupak guna. This cause of effective treatment of acute lesions and removal of pigmentation and scars. Material and methods. The present study was an observational treatment clinical trial. The investigator observed the patients and measure or evaluate the outcome. The type of methodology adopted for the study was single-blind, randomly controlled clinical trial. Sources of data. The study was hospital-based, which was conducted in the OPD unit of NIE Hospital. The patients suffering from Muktushika who fulfilled the criteria for the inclusion in the study and who were registered in the institute were selected for the study. A total of 30 patients were selected for the current trial work. Inclusion criteria: patient in the age of 15 to 30 years of age, patients of either sex, patients having cardinal features of Muktushika as per Ayurvedic and modern literature, patients willing to undergo the trial. Exclusion criteria: patients below 15 and above 30 years of age, patient associated with other stomach disorder, patient with acne fulminans, patients of acne infantile, acne due to tubercular therapy, malignant cases. The subjective parameters of assessment are severity, itching, pain, discharge, and burning sensation are graded from 0 to 3. Laboratory parameters: complete hemogram, serum cholesterol, serum testosterone. Plan of study: 30 clinically diagnosed and confirmed patients of Muktushika were selected and randomly divided into following 3 groups with 10 patients each. Group A: in this group, all the 10 patients were given topical treatment Mukkantikar Lep to apply externally for 2 months. Group B: in this group, all the 10 patients were given oral and topical treatment Sapsam Yog and Mukkantikar Lep respectively for 2 months. Group C: all the 10 patients were given oral treatment Sapsam Yog for 2 months. The duration of treatment was of 2 months. Sapsam Yog 6 gram twice a day after meals with normal water. Mukkantikar Lep sufficient quantity as needed applied specifically on the lesions for 30 minutes twice a day and then washed off with warm water. Follow-up: the patients were subjectively assessed for every 15 days. Observation: age-wise distribution of 30 patients, sex-wise, marital status, diet, Agnibal, coast, Shararik Prakriti, SAR, previous treatment of history, stress, part affected, distribution, lesion type. Clinical recovery in Group A treated with Mukkantikar Lep. We got significant result in severity, Kandu, Vedna, Srav, and in Daha we got insignificant result. Group B treated with Mukkantikar Lep and Sapsam Yog. We got highly significant result in severity, Kandu, Vedna, Srav, and in Daha significant result. Group C, severity, Kandu, Vedna, Srav, we got highly significant result, and in Daha significant result. Effect of hematological values of Group A. High, insignificant result. Group B insignificant. Group C insignificant result. A case before and after treatment. Overall result showing cumulative efficacy of treatment regime. Group A 50.71%, Group B 73.37%, Group C 50.34%. Discussion: the disease Muktushika has been in existence since time of Samhita till today. In those times, it was discussed as Shudra Rog, but in today's scenario, it is one of the major cosmetic concerns in the youth all over the world. It has also been seen that the occurrence and severity has a relation with diet, bowel, Agnibal, personal dietary habits, seasonal influence, etc. It was also seen that majority of the sample population did not have any aggravating factor. It was observed that Vat, Pitta and Vat Kapha, Prakriti and Medsar and Raktasar people and people with Vishma Agni were more prone to Muktushika occurrence. It was observed that there is no possible etiology that can be singled out which causes Muktushika alone. It is probably due to cumulative effect of various Aharach and Viharach Nidan. Although significant changes were seen in severity and symptoms of Mukh Doshika due to the use of the trial drugs, no significant rose was seen in hematological and hormonal values. Very significant changes were seen when the trial drugs Sapsam Yog and Mukh Kantikar Lep were used together. It may be due to the fact that the disorder was checked completely by internal and topical remedies. Conclusion: seeing the above results, we can conclude that the effect of Sapsam Yog and Mukh Kantikar Lep were considerably significant. However, in the reducing the severity and daha, combined use of the oral and topical drug proved more beneficial. The results of the study were very encouraging. Seeing the results, the drugs Sapsam Yog and Mukh Kantikar Lep can be considered as an effective therapeutic regime to treat Mukh Doshika. There was considerable improvement and no unwanted side effect in the patients, but since a small sample was selected for the study due to various limitations, it would be beneficial to conduct the study in large sample of patients with better parameters. Standardization of the medicine, which will give better figures for pronouncing their results more efficaciously. Thank you.
We'd like to have some questions here.
Talking of teenagers, but cases selected you have taken 10 to 30 years.
Yes.
Because with age, due to some hormonal changes, this age group, broad age group is not justified. 10 to 30 years, they are not teens.
So especially इसी एज ग्रुप में होता है ना?
नहीं होता है, but you are talking of the teenager problems, teenage.
Yes sir.
So 10 to 19 on.
नहीं सर, ऐसा कुछ नहीं है. जो मेरी स्टडी में आए हैं वो इस तरह के पेशेंट्स भी आए हैं सर.
But your objective was among teenagers only.
स्पेशली सर टीनेज में होता है, बट जो हमने पेशेंट्स लिए हैं वो 30 इयर्स तक के पेशेंट्स लिए.
But they are not comparable. Due to hormonal changes, married, unmarried, they are not comparable in my opinion. And what about your severity scores and outcome parameters? You have given weightage whether those scores were justified or not.
तो मेरी स्टडी में जिस तरह से आया मैंने उस तरह से आपको बताया है. सर स्कोरिंग भी अकॉर्डिंग टू उसके लिए उसी के हिसाब से लिया है मैंने. थैंक यू सर. Yes, sir.
Does it really contain arsenic?
आर्सेनिक डाइसल्फाइड ओरली नहीं है सर, लोकली जो लगाने के लिए. नहीं, ओरली अगर लेंगे तो सर वो
Thank you, Dr. Anita. Please collect your certificate.
Madam, Cremic is not antimicrobial. Cremic means deworming or anti-allergy. Cremic is not antibacterial.
A round of applause for Dr. Anita, please. Now I would like to call upon Dr. Santosh Kumar Bhattar for his presentation. He is from National Institute of Ayurveda.
Thank you, madam. Respected chair, colleagues, and my friends. First of all, I would like to thank the organizers for being given me an opportunity to share my views and clinical experience on a very specialized topic. So far, since morning, we are hearing about the different aspects of the health and the medicine. One of the aspects which is most important and which is most vital, which can be considered as the most basic instinct. The most basic instinct of a living being in general and a human being in particular is to reproduce. And when it comes to be an inability to reproduce, we can assume what kind of pain the sufferer will feel at the level of personal, family, social, and the financial losses. So I'll be talking about that crucial aspect, so-called the infertility. In that particularly, I would like to touch upon the male infertility. Why I am touching this particular topic is I did extensive work in my post-graduation as a part of MD studies and as a part of my PhD studies on this related topic. Friends, as you know, there is a lot of development in the technology overall and particularly in the field of medicine. The medicine has given us the complete understanding about all the aspects of fertility. At different stages what happens and what could be a medication. But still, the effective management of infertility is a catastrophe. Still, it is a awaited destiny. On the other hand, if you look at Ayurveda, Ayurveda has explained both the etiopathogenesis of infertility as well as the management in much detail. So I'll be talking about that core aspect of Ayurveda where the various pathologies related to the male infertility are described under the broad heading of Shukra Dushti or Reto Dushti, and its management is specialized developed branches there in Ayurveda, so-called the Vajikarana or the andrology in Ayurveda. Apart from that, we have another important contribution from Ayurveda to the medical science, that is the Panchakarma, which is basic correction of the root cause. So with the help of Panchakarma and the Vajikarana or the drugs coming under Vajikarana, how we will manage the male infertility, that is the area of my presentation. With this, next. So in my presentation, I'll be talking about a brief understanding of male infertility. I'll be mainly touching upon the various causes, particularly the pathological causes involved in the male infertility. Then I'll be coming to the topic of Ayurveda, that is different types of Shukra Dushti or Reto Dushti, and its modern parlance. That is the core aspect of my presentation, that whatever modern pathological classification they have given for the various seminal abnormalities. For example, patient come with a diagnosis of oligospermia, azoospermia, asthenozoospermia, agglutination. So how it can be understood in Ayurveda, and then what is a lead of hope, or what kind of line of treatment, or what are the drugs. So that I will be talking in my presentation. Before going to the core aspect, let us have an understanding about the incidence. The global incidence reported so far is the 16.7% couples are suffering with the infertility. And the contribution of this development is earlier only the females were considered, and nowadays at least in 50% of the cases the males are equally responsible for the infertility. That's why I would like to put more emphasis on the male infertility. So this infertility again precisely is described as a couple's inability to achieve this, to get the babies or offspring in spite of having a regular sexual intercourse with an adequate frequency over a period of 1 year without using any contraception. This is the definition given for a infertility. If couple comes with a married life of 3 years, directly we cannot call them as an infertile couple until and unless we won't consider all these 4 factors in the definition of infertility. So before going to the management, we must understand what is the level of problem. The level of problem could be in the spermatogenesis, that is the defective spermatogenesis. The level of problem could be in the seminal fluid or the various seminal abnormalities. The level of problem could be in the anatomical defect, that is in the transportation. And the level of problem could be only the sexual dysfunction. The defective spermatogenesis could be an hereditary, it could be a congenital, it could be a developmental factor. Apart from that, these 3 factors we are very much less to do. As per Ayurveda also, it is this Sahaja condition, we can't do much. But the other conditions which comes under the heading of acquired, and there are so many things they have enlisted, starting from the drugs, growth, infectious condition, metabolic conditions, systemic conditions, so many things they have explained. And lastly, they have mentioned one more point, that is unexplained causes. That is also very important, which Ayurveda justifies. The second kind of problem could be a seminal abnormalities, for which Ayurveda gives an explanation, that is 8 types of Reto Dushti or Shukra Dushtis are described. Then the third kind of problem is anatomical disorders. Here mainly 2 kind of anatomical defects which comes in the path of fertility. That is the one is varicocele, which may result into asthenospermia, or it may reduce the motility and simultaneously the density of the sperms. And the second is the obstruction in the afferent duct. And lastly, the different kinds of sexual dysfunction, particularly the deposition of sperm higher in the vagina is most important to get conception. So if there is a erectile dysfunction or ejaculatory disturbance is there, then this may not be possible, and that could be one of the cause for the infertility. So after having a brief understanding about male infertility, I'll be talking about how it can be understood in Ayurveda. The whole pathologies coming for the male infertility, particularly seminal abnormalities, are described under the heading of Shukra Dushti. This can be understood in 2 aspects. One is the pathology related to the Shukra, and another is pathology related to the dosha affecting the Shukra. The pathology related to the Shukra could be a genetic or could be a congenital, that is Bija, Bija Bhaga or Bija Bhagavaya Upatapta, and the problem may be related to the Shukra Sroto Dushti. The other pathologies may be the affection of the dosha and that later on afflicting the Shukra, that is Shukra Pradoshaja Vikara or the Shukra Gatavata or the Shukravrutavata or Vanavrutapana. These are the other conditions. Now, as I mentioned, if I take some more time, is it okay? As I mentioned, defective spermatogenesis is the first cause which can be very well correlated to that of Shukra Kshaya in Ayurveda, and Shukra Kshaya is precisely categorized in Ayurveda into 3 broader headings, that is Alpa, Kshina and Vishushka. So this is nothing but a gradation from moderate oligospermia to a azoospermia. So what kind of line of treatment should be given is precisely mentioned in the Dallana commentary. If there is an Alpa Shukra, which commonly happens at an young age, it is moderate oligospermia, and there the up panel line of treatment is effective. And Kshina Shukra, which happens as a part of middle age, their Upachaya line of treatment. And the Vishushka could be a pathological or could be a physiological. If it happens in an young age, then it is a physiological, and if it happens at a older age, then it is a physiological, and younger age, it is a pathological, and then particularly we have to go for the Shukra Janana Dravya. So what is oligospermia? If you look into the data available, the density of sperms, which was about 113 million around 1950, and which has reduced to just 60 million in a duration of 40 years, that indicates the density of sperms is falling about 40 to 50% in these 50 years of time, and that makes a major concern. And to call somebody as suffering with oligospermia, as per WHO guidelines, the sperm density should be lesser than 20 million. To call somebody suffering with azoospermia, there should not be any sperms in the ejaculation, and it is the most troublesome condition. Some of our people, they would explain that we are going to treat azoospermia. Only the obstructive azoospermia can be treated. If the azoospermia is due to primary testicular failure, or if it is because of the primary hypogonadism, then the outcome of the treatment is very poor. So we should be very careful to claim if we are treating azoospermia. That's why I have pointed out how to find out the cause is very important. If you come across a case of azoospermia, if it is associated with the defective spermatogenesis, then the line of treatment is different. And if it is because of the obstructive pathology, then the line of treatment is different. There more of the Uttar Basti is effective. Then now coming to the 8 types of Shukra Dushti and its parallel correlation in the modern medicine, and what I practice and what are the so far researches conducted on this with my different friends. They have conducted on all the aspects. Particularly, I would like to give a appreciation to the IPGT and RA Jamnagar, which has taken a lead in the field of this Vajikarana. My senior friends, one of friend Dr. Pawan Godatwar is also sitting, who has worked on the basically on the Shukra with the, I think, Suvarna Basma, if I am not wrong. Shukra. So a series of works were conducted at IPGT and RA Jamnagar, which involved the different aspects of seminal abnormalities and its correlation and taking a lead from this and putting in the research. So I'll be talking all these things. So Vataja Shukra Dushti, I will just give an exercise how we can interpret. If you look into the physico-chemical parameters described for the Vataja Shukra Dushti, which is mentioned as Aruna, Neela, Aruna and Krishna Varna, Fenila. Particularly when we were doing the seminal parameters, myself I was doing the seminal assessment, so you will look into the semen, then it will be a frothy, typically as mentioned in the Vata Shukra Dushti, no modern medicine mentioned. And when you do the pH assessment, the pH will be more than 8.5, which can be considered as the Ruksha parameter given for the Vataja Shukra Dushti. In this way, we can take the Vataja Shukra Dushti in terms of seminal parameter, and this can be considered as one of the presentation of oligozoospermia, azoospermia, and particularly I would like to consider it as also a part of teratozoospermia, because teratos refers to the abnormal forms, and Vata is considered as Dhatu Vihakara and Dhatu Sandhanakara or the Rachanakara. That means the shape giving is due to the Vata. So abnormal forms can be considered because of the abnormality of the Vata. So this way also it can be considered. Coming to the line of treatment, there are some of the researches conducted, particularly the Basti showed to be an effective treatment, particularly the Baladi Yapan Bastis. Those people are from Ayurveda, they can understand. There are two Bastis, one is Mash Atma Guptadi Basti and another is a Baladi Yapan Basti. They are very effective in the treatment of oligozoospermia. And there is another Basti which is effective in the treatment of teratozoospermia. Dr. Nitin Vise worked on this teratozoospermia, and he also used a kind of Basti which was effective in the treatment of teratozoospermia. Apart from that, the line of treatment should be usage of some kind of Grita, particularly the Shatavari Grita is effective. And one thing I would like to share with the audience, generally this Ashwagandha is practiced for the treatment of infertility. Friends, remember, don't prescribe Ashwagandha to the patients of oligozoospermia or azoospermia. It reduces the density of sperms. This is my clinical experience, so don't prescribe Ashwagandha to the patients of oligozoospermia or azoospermia. Now next, coming to the Pitta Shukra Dushti, to me it looks like more of the inflammatory condition of the reproductive tract or the genital tract. And what kind of treatment can be practiced for the Pitta Shukra Dushti is mainly here you have to go for the Rasayana treatments, particularly the Brahma Rasayana 1 and 2 are found to be effective. Apart from that, Amalaki Rasayana is also given in clinical practice, it was also effective. Aritakyadi Rasayana, though it is mentioned in the text, it is less practiced. Then other drugs which were used for the treatment of Pitta Shukra Dushti are inflammatory conditions of the genital tract, where Sariva was found to be very effective. In addition to that, Sariva, one more study was conducted by Ravi Shankar, and that was usage of Chopachini. So that was also found to be an effective treatment. It was not mentioned originally, but taking from the Bhav Prakash, it has utilized. Then different kinds of Gritapana can be given for the Pitta Shukra Dushti. And Virechana, particularly this Virechana with the Trivruta Grita and Asthapana Basti was practiced with the by usage of Shalaparani, this Shalaparani and Akshira Vidari. This was effective in the treatment of Pitta Shukra Dushti. Now my study was on the Kafaja Shukra Dushti. Kapha Shukra Dushti is very common in the society. It refers to the immunological factor, immunological infertility, particularly the autoagglutination factor, where the anti-sperm antibodies are produced. The sperm density is above normal. I had a case who was running a shoe shop in Jamnagar, and his sperm density was about 300 million, but whole was autoagglutinated sperm. So nothing can be possible. So that was a very good case, and such cases we have considered as the part of Kafaja Shukra Dushti. So I would like to consider Kafaja Shukra Dushti referring to the hyperviscous semen, delayed liquefaction, ostenozoospermia, and autoagglutination. Then ostenozoospermia is also a major factor coming under the infertility. Here, the motility is reduced below 50%, and at least in 24% of the cases, ostenozoospermia is considered as a sole responsible factor for the infertility, and in addition to the other factors, in 55% it is considered as the factor involved in the ostenozoospermia. Now coming to the, I will, as the chairman is telling me to submit, so I will just come to the last slide. The treatment of male infertility in general can be planned. One is starting with the Panchakarma, as the Charaka's dictum goes, like Panchakarma Vishuddhasya Purushasya Api Cha Indriyam. Here Indriyam is translated by Chakrapani as Shukram. So ultimately, to treat the infertility, you have to start with the Panchakarma, and methodically, in accordance to the doshic dominance, you have to go with the Vamana, Virechana, Vasti, and particularly the Uttar Vasti, proceeding with the Sthayana and Svedana. Then second part is there is one more Gana called as Shukra Shodhana Gana, which I have used in a oral group as well as in a Uttar Basti group in the treatment of Kafaja Shukra Dusti, which consists of Shati, that is Kapur Kajli, then Katfala, Kushta, and Palashakshara. So that was used in the form of Kshira. So that is a very good combination, and most of the drugs coming under the Shukra Shodhana Gana. Apart from that, my own opinion is we can go with the Stanya Shodhana Gana is also there. And as far as the Shamana is concerned, the different Vajikarana drugs or the Vrusha drugs can be utilized, and as a general rule, you can go with the Jivaniya Grita, Chavana Prasha, and Shilajato. With this, I would like to thank the organizers for being given me an opportunity. And lastly, the 4 steps that must be remembered. One is the psychological betterment of the patient, because Saumanasyam Garbhakaranam Sreshtam, then general well-being of the patient, then the sexual well-being of the patient, and then selection of the specific treatment from the Panchakarma and from the Vajikarana drugs in accordance to the Nidana, Dosha, Dusha. That makes the better treatment modality for the treating patients of male infertility. Thank you.
Somebody has questions?
May I have water, please?
Questions? Anybody?
Wonderful presentation, but we missed, and we wanted to avail that opportunity to go into more details of this study, but that could not be possible due to chairman decision. So I was more interested in sexual dysfunction, and that is the main cause of male infertility.
Specialization area, sexual dysfunction is another important area. So that requires a separate total understanding. I would like to classify the sexual dysfunction, if just 1 minute.
But certainly we would like to invite you in our institution for this wonderful presentation.
The DSM-4 classifies sexual dysfunction under 4 major categories. There are 7, but 4 are major categories. One is the sexual desire disorder, that is hypo-desire disorder. Then sexual arousal disorder, that is erectile dysfunction. And precisely I would like to consider Clybia. Clybia, the definition of Clybia justifies both the lack of erection and lack of rigidity, which is a erectile disorder. Then the ejaculatory disorders, that refers to the Shukra Gata Vata, Shipram Munchati Badnati, both early and delayed ejaculation. And orgasmic disorders, that comes under the Apraharsha. So that is a separate heading. I have myself
Although
male infertility.
due to time limitation, we cannot go into detail, but particularly for one interesting case which you have referred, one interesting case which you have referred, about 300 million. That clinical case, please give a little detail of that case.
My both students are sitting here. Now a infertile couple is admitted at NI Hospital, Jaipur. And the female has already undergone Virechana Karma, and today I think the male person may take the Virechana Karma. The male is suffering with oligospermia. The sperm density is 12 million. And female factor is suffering with the polycystic ovarian disease. So we have planned the classical Virechana Karma, looking into the line of treatment described from the Shukra Pradosha Vikara. Shukra Samutthana, this Virechana is the line of treatment first. So that's why we have given this Virechana, classical Virechana. And the patients are now under our treatment at NI Hospital for the last 13 days. Classical, methodical treatment, 5 days, 10 days, Sneha, Sveda, Stan, Parishtuta, Shodaya, Shodana. According to that concept only we will go. So there are many cases. Just one experience, you may not permit. And in my clinical practice, in my own clinic, when I was doing my practice here nearby Bidar is a place, one Tahsildar daughter. Yes, I will talk. That's why I was telling you. One last question, please. Yes.
Hello, I'm Dr. Shashikant Seth from Bombay. I just said I'm late, but actually, lastly, I just point out that you have said this is not, no, ashwagandha is not correct thing. So what do you suggest for that? And substitute for that?
Oligospermia, you have to be cautious. The 2 useful drugs could be Shatavari and Vidari Gandha, but Vidari Gandha has sometimes produced an adverse effect lacking in the body. The modern counterpart is here. So if you give Vidari Gandha, so it will increase prolactin level, and some of the male patients they have developed gynecomastia. So the better drug for the treatment of oligospermia could be Shatavari and Musli and Kapi Kachu. These are the three drugs I practice differently according to the patient.
Thank you very much.
Thank you very much, Dr. Santosh, for your wonderful presentation. Thank you, sir. By coming to the end of this day, I would really like to appreciate all the speakers and attendees who have come here to attend this session, and it was really a very interesting session today. And I would really like to thank our chair and co-chair for this session. I invite Dr. Avinash Kumar for his presentation, for his closing speech on the session.
Respected audience, my dear friends, I am very much thankful to all the delegates and the audience and the persons who have presented the paper. This is the scientific session and we are having the limitations. We have not done anything bias. As we are the persons who are signatory of the other institutions, we should maintain the time. This is our prime motto, and we should have the ability to finish within the time. This is our house conference. This is not a broad conference. We may have a conference where we will get less time than this one. Sometimes the time is reduced at the time of presentation. So we should have caliber to present that one and finish that one within the period. I am very sorry to interrupt in between. Very much thankful to you for the presentation. Thank you.
Thank you, Dr. Avinash. I really appreciate your words. I thereby request Dr. A.K. Panda for felicitating Dr. Avinash with a certificate. Please, ladies and gentlemen, round of applause for them. They've been really wonderful chair and co-chair. I now invite Dr. A.K. Panda for his closing speech.
Respected chairperson of this session, my dear friends. Actually, really very fantastic presentations, and I appreciate many of the presentations. They are very scientific, and although they are postgraduate students, and because I commended because to stop and theoreticals like that, because we need a lot of data for to make the Ayurveda more evidence based, and really I appreciate it. We are also practicing infertility, and I basically give Chawanpras and Satavari. So what, sir? These are all, if we meet together and do like that of interactions, then what we done in clinical practice can be revised. So thank you all, and try to give more experimental or clinical orientation, epidemiological orientation, rather to tell only the theories and what in written in our text and correlation with modern. Thank you.
Thank you very much, Dr. Panda. I would request Dr. Avinash to felicitate Dr. A.K. Panda with a certificate. Thank you so much, sir. I'm sorry the photographer is not here. Thank you very much, sir. I thank all of you for joining with us, and I would like to brief you for tomorrow's session, which will be starting by 10 o'clock in both the Azures. So please welcome, you all are welcome for tomorrow's session. Thank you very much and have a pleasant evening.